Your recent LinkedIn post where you argue, I'm quoting, if you are designing for reimbursement, you are not designing for care. And then you extend this to say, we keep trying to reward digital transformation with analog incentives. Can you explain?
And now that we have AI at our fingertips, we are seeing the same cycles that I have seen about discussions about how do you implement it, how do you pay for it, how are we going to make quality care, how do we make it safe? The exact questions that I heard over and over and over the last 12 years are happening about AI. And so when I was thinking about, and this particular blog came out of just seeing that pattern and thinking, when we in general are ending up doing the same thing, and I'm worried we're going to have the same problem again in that reimbursement is going to create products that people can't really use very well. That's what I mean by the analog incentives. It's like what they think that reimbursement is happening. Because right now we are still building out those AI reimbursement codes. There's about 2 that exist, but again, they're very specific and niche. And so whoever is building is basically thinking, what is going to be the way that we pay for AI? And it's an interesting question too, because at the moment, the way that we actually pay for clinical care is by how long it takes or decision making. And with AI, that might take that away. And so we'll have to rethink how reimbursement happens overall. And so I'm saying that when companies are building just thinking in this manner and trying to solve a problem that they do not know or cannot really predict, it's not going to work. What they actually need to do, and all the telemedicine and RPM platforms that have done this, where they actually built it for the clician, for the healthcare system, made it patient-friendly and easy, those are the ones that actually worked. And because theirs worked, they were able to come to the government and say, this is how we built this out. And reimbursement was built around it. And so I'm trying to basically warn everybody, you want to actually do it in the reverse way, make the right product. And reimbursement can follow in the way that we do it in the US.